Welcome back to Basic Medication Administration Training, Part 2. Governor Ron DeSantis, APD Director Barbara Palmer. Routes of Medicine Administration. Procedures for giving medicines by the following routes: oral, internal, otic, ophthalmic, inhaled, topical, transdermal, and rectal. Medicine administration. Initial preparation is the same for all routes of medicine. Wash your hands or use alcohol-based hand sanitizer. Gather the equipment you will need: a medicine cup, a syringe, gloves, pill cutter or crusher, paper towels, water, and spoon. The supplies you will need will depend on the forms of medication that you are administering. If you are given medication via G-tube, you will need a pill crusher, unless all the medicines are in liquid form. Again, hand washing is very critical. Always wash your hands with soap and water. You should use soap and water if your hands are visibly soiled and greasy, after using the bathroom, or after assisting a client to use the bathroom, or perform any other personal hygiene task. Make sure you have all the supplies and equipment you will need before you start pouring medicines. You do not want to leave medicines unsupervised to get something that you need. If you are using latex gloves, make sure your client does not have any allergies specific to latex. Medicine administration. Initial preparation is the same for all routes of administration. You must plan your routine when giving your medication. Do not wait until the last minute. It is important to get to know your clients, review the medications, and learn what works best for each of them. Identify your client and confirm that it is time for their medicine. Right client, right time. A consistent routine when giving medicines will lead to fewer mistakes. Rushing always causes errors. Allow time to get your task done. Knowing that your client is one key to safe medicine administration. What do they need to take with their medicines? Do they prefer water or do they prefer juice? Some like pudding and applesauce. You may want to mix whole medicines in pudding, applesauce, ice cream, or any substance the client prefers without an order. If you must crush or dilute or dissolve a medicine, you will need an order to do so. Know who you are supervising or giving medicines to when they are being given. Medicine administration. Things to watch for when medicine is being administered. Check for special instructions such as check blood pressure or heart rate before giving medicine. Make sure you understand how to operate any equipment required to be utilized to provide assistance. Ensure that the prescriptions are filled on time. If you are not responsible for the routine refills, notify the person that is responsible when more medicines are needed. Document. If there are problems, report to a nurse or supervisor per your facility's policy. If you are unsure about something, always ask your supervisor. Do not be afraid to ask. If there are special instructions such as hold a medicine if the blood pressure is below a certain amount, you must follow them and document exactly on the MAR what was done and why it was done. This is done at the back of the MAR. Medicine administration. It is important to unlock medicine storage area and take out medicines only for one client at a time, and relock the storage area each time. Yes, you need to unlock the medical storage only long enough just to remove the medicines that the client you will be assisting needs. And you need to make sure it is locked and the key is kept in your possession at all times while you're doing medicine administration. You will check each medicine listed on the client's MAR for the administration time and route. Check the medication expiration dates. Compare the label information to the MAR and the prescription to ensure you have the right medicines, the right dose, the right route, the right time. Each information must be correct before you continue. Are there any special instructions? You need to follow this. Do you crush, dilute, dissolve medicines? You must do so if it is ordered to do such a thing. Providing privacy prevents medicine errors since there are fewer distractions and less chance for another client to grab the medications. Privacy is necessary for any medicine administration that exposes the body, rectal, topical, transdermal. Many people prefer not to be watched by others while taking medicines these ways. So again, provide privacy when needed and always explain to the client what you are doing. Oral medications come in many forms. Solids includes tablets, caplets, capsules, and gel caps, and often are called pills. Some pills are chewable, some may be crushed, others must be swallowed whole. It is important to make sure the instructions is followed. Some capsules may be opened and sprinkled on food. If you want to alter the original form of solid medication by crushing and dissolving, you must have an order from a medical provider to do so. No order is required to chew a chewable, but the pill is not labeled as chewable, it should not be chewed, especially if it is an extended release or long-acting medication, or if it has an enteric coating for the protection of the stomach. There are also solid powders, tablets, that are meant to be dissolved in liquid before consumption. Liquid oral medicines may come in syrups, suspensions, solutions, drops, or emulsions. When giving both pills and liquid oral medicines, always give the pills first before the liquid. For medications that are meant to be dissolved, chewed, or sprinkled, no specific order is necessary. However, if a person's prescription medicine, follow the pharmacist's directions specifically as it is labeled. If an over-the-counter, follow the instructions to the manufacturer's label, unless the client's healthcare provider has ordered it to be done in a different manner. Here are some examples of how tablets, caplets, capsules, and gel caps may look. Notice the color may be different for your specific medications, but generally this is how the pills will look. When given oral medications, you must make sure to follow the special instructions. These may be ordered by a prescriber or found on the supplemental materials on the packaging. Some examples include: take the medication on an empty stomach, take with food, hold for heart rate pulse less than 60. Do not give a client if the client is having diarrhea. These are all important instructions to follow. Pop the medication into a medicine cup or if pouring a pill from the pill bottle, pour from the bottle into the lid and take the med cap. Then take it into the med cap. Do not touch the medication with your fingers. If too many pills are poured into the lid, you can pour them back into the bottle and try it again. Again, it is important not to touch the medication. Cross medicines, if required, and mix with whatever substance the client prefers, applesauce, pudding, or ice cream. Unless the prescriber has given a specific order, you are not to do such a thing. So again, it depends on the prescriber and their order. Check supplemental labels to make sure you're not mixing the medicine with food it should not be given with. Milk products such as ice cream, yogurt, and puddings may not be given with certain medications as they prevent absorption. Always check with supplemental labels before doing things like this. Hand the medicine cup to the client with a glass of their preferred liquid. If they prefer a thicker substance for taking pills, have them use a spoon to bring it to their mouth. Give them only as many pills as they can swallow at one time. If supervising self-medication, make sure the client has the correct pills and the correct amount of each medicine. As you give medicines, always discuss with the client what the medicines they are taking and why they're taking it. Ask questions. What is this pill called? Why do you take it? To ensure that the client understands properly why they're taking the medicine and what pills they are taking. If you are supervising self-administration of oral medications, always ask questions when they take it. What foods to avoid when they're taking it? And what do they do if they miss a dose? After you're done giving all the pills, check to make sure the client has swallowed all of them. Some clients will cheat medicines and then throw them away or save them to take them later, which can lead to overdoses. As you realize, it is important that clients take their medicines and that you ensure the medicines are taken. And it is very important to prevent possible accidents such as overdose. It's possible that you will give liquid oral medications. This comes from time to time for certain medications are going to be liquid. You will shake the bottle before pouring. It's very important to shake the bottle before pouring because many medicines will settle. So then you'll remove the cap and put it down with the lip facing up to avoid contamination. Use the dosing cup that comes with the medication if possible. Do not use household spoons to measure medications. Make sure the dosing cup is on a level surface for accurate measuring. If it's tilted, it will not be an accurate pouring. Pour away from the label to ensure it remains legible and no drips can fall on the label. Wipe the lid and the neck of the bottle with a paper towel before storing. At our group home, we recommend not using it damp because this can sometimes cause the liquid to form a germ. So it is better just to wipe it with a paper towel if possible. When the cup hold with the cup at eye level, read the amount of the medicine on the bottom of the curve of the liquid forms in the cup. If the supervising self-medication, you may need to help the client open the bottle and check the measurement, close and clean the bottle. You might need to help pour it. Always give the liquid cough medicines last to coat the throat. Again, do not use household spoons to measure. Must use a measuring cup because the measurement will not be accurate with household spoons. As liquid medication may be given with a dosing spoon, oral syringe, dropper, or other measuring device, always use the device that comes along with the medication. If the medicine doesn't come with a measuring device, make sure you're giving the medicine in the exact units as prescribed. ml/cc. These are the same. Also, teaspoons or tablespoons are considered measurements. Oral medication, Bacrol and sublingual. Bacrol medication is placed between the gums and the lining of the cheek, as you can see in this picture. Sublingual medicine is placed under the tongue, as reflected in this picture. Both of these are allowed to dissolve where they are placed. They should not be chewed, and the client should not drink anything until the tablet is totally dissolved and absorbed. There are many types of inhalers. We will briefly discuss each type of inhaler and how to use it. If your client has an inhaler, you do not know how to use it, always ask for help. You may reach out to your supervisor if you do not know how an inhaler is used to ensure. Also, the pharmacist, prescriber, and responsible respiratory therapist or nurse can teach you how to use it. You must use these resources if you do not understand how it is used properly. This is a metered dose inhaler. It is the most common type of inhaler that you will see. When you press down on the canister, a puff of aerosol medicine comes out of the mouthpiece and is breathed deep into the lungs. It takes practice for a client to properly utilize this type of inhaler. To use a metered dose inhaler, the client will open the mouth and provide the puff. This is one method. Another method is to use a spacer, which helps ensure proper doses being breathed in. The other one is a closed mouth technique. A spacer is tended to use with a mask. It's most commonly used with children and not adults. If there's more than one type of inhaler to be used by the client, make sure you know the proper order to give them in. And here's a step-by-step way of using the metered dose inhalers. First, you will remove the cap from the mouthpiece. Then you will ensure that the mouthpiece is clean. Shake the inhaler, as some of the settlements of the medicines may settle. So therefore, ensure it is well shaken. Have the client sit up straight and tilt their head back slightly. Ask the client to breathe out. Then place the mouthpiece between the lips and ask the client to close their lips. Spacers may be utilized if the client can't close their lips around the mouthpiece. Open mouth technique should be the last resort utilized, as some of the medicine may not be taken as prescribed if you use the open mouth method. Ask the client to breathe in slowly as you push down the inhaler canister. Have the client hold their breath with the mouth closed for a few seconds as you remove the inhaler. Then you need to ask the client to breathe out. And if a second puff is ordered, wait at least 1 minute to 2 minutes to give the next puff. It is better to wait to 2 minutes if possible. Then you will rinse the mouthpiece or the spacer if the spacer is utilized and replace the cap. Ask the client to rinse their mouth. It is important for the client to rinse their mouth to prevent any bacteria. Again, if the client uses more than one inhaler, make sure you know which one to give first because it can make a difference on how effective the medicines are utilized. The client should breathe in slowly and deeply as you push the canister. They should not take rapid deep breaths as if they were gasping. You may need to demonstrate this type of breath you want them to take. This may be difficult to teach the client, but just keep trying. If a client's symptoms, usually difficult breathing, wheezing, are not getting better because the learning practice is slow, you should let your healthcare provider know immediately. They may want to change a different method or add a different method until the client properly learns how to use the inhaler. Again, these are the step-by-step instructions on using metered dose inhalers. There are dry powder inhalers. Dry powder inhalers deliver preset doses of medicine in powder format. Powder gets into the airways when a deep, fast breath is taken from one of the inhalers. Always read the instructions that come with the inhaler that you're using to make sure it's utilized properly. Ask the client's pharmacist or other healthcare professional to show you how to use the inhaler properly and to describe the proper technique to use to deliver this medicine into the lungs. Just like metered dose inhalers, there are many types of dry powder inhalers as well. Some come preloaded, others must be loaded every time you utilize them. It is important not to breathe into the inhaler and not to get it wet to make sure the powder consistently stays dry. Here's the step-by-step instructions on how to use the dry powder inhaler. First, you will remove the cap and hold the inhaler upright like a rocket ship or flat if it is a disc. Load a dose of medicine into the inhaler. Following the directions provided with the inhaler, you may have to prime the inhaler first time you utilize it. Do not tilt or shake the inhaler. Ask the client to not to breathe into it. Ask the client to stand or sit up straight and take a deep breath and blow it out completely just to empty the lungs out of the air. Place the mouthpiece in the client's mouth and ask them to close their lips around it. Instruct the client to breathe forcefully, deeply, as they breathe in the dry powder. Have the client to hold their breath for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then you can remove the mouthpiece from the client's mouth and ask them to breathe out slowly, facing away from the inhaler. If there is more than one inhalation per dose, wait 1 minute to 2 minutes before taking the second dose. When finished, put the cover back on and store in a dry place. If using an inhaled steroid, have the client rinse their mouth with water and spit it out to prevent any possible mouth bacteria or infections. The standing up or sitting up straight is important because it expands the lungs, allowing the medicine to reach all parts of the lungs necessary. And as always, if you do not understand how to use this inhaler properly after reading the instructions, always reach out to help. Again, you can reach out to your supervisor, or you can talk to a pharmacist or a medical personnel. However, your supervisor should always be ready and available. Remember, you're teaching the client on how to use that device, so you must understand how to use it first. Some of your clients will use a nebulizer. A nebulizer is an effective manner of delivering medicine to the lungs. Here's going to be a step-by-step process, but even though it's not listed as a step, I will insert here step 0. And the step 0 is to always wash your hands thoroughly first. As you remember, we talked about hand washing before. It is very important you wash your hands first. Step 1 will be to unscrew the top of the nebulizer cap and place the medicine in the cup. Most medicines come with a pre-measured vial. Step number 2, screw the top back on and attach either the mask or the mouthpiece. Most nebulizers you'll see will be coming with mouthpieces. Step number 3, if using a mouthpiece, attach the T-piece to the nebulizer cup and then add the mouthpiece to the reservoir tube. Step 4, attach the end of the tubing at the bottom of the nebulizer cup. Connect to the other end of the nebulizer machine. Step number 5, turn on the machine and use the nebulizer. Put the mouthpiece in the mouth above the tongue. Keep the lips sealed tightly. Have the client inhale deeply through the mouth. Use an aerosol mask if the client is very young and unable to hold the mouthpiece. Mask must be attached to the top of the nebulizer cup, as demonstrated in this picture. The client may exhale through their mouthpiece or the nose. Make sure you have the client sit up and keep inhaling, again, to make sure the lungs are fully stretched out so they can properly receive the medicine. You're going to have the client keep inhaling the medication until the mist stops. The nebulizer cup should be empty before the client stops inhaling. Once the cup is empty, you will turn off the machine, unplug it, and detach the parts from the tubing. After each use, wash the medicine cup, mouthpiece, or mask, T-piece in a warm soapy water like shown above. Rinse. Make sure the soap is clear and the water is fully rinsed off. Then you will air dry it. Do not wash the tubing, however. Don't ever use the dishwasher to clean nebulizer parts. This will damage the parts. Again, you will do it by hand as displayed in the picture. Once a week, if a new nebulizer is not supplied, you may soak the plastic nebulizer part, not the tubing, in a solution of 1 part white distilled vinegar and 3 parts hot water for 1 hour. Then you will rinse the parts to make sure that all parts are clear and then air dry. Nose sprays. Most nose sprays come in bottles like the ones shown in this picture. They are held with the thumb on the bottom and the index and middle finger on either side of the nozzle. This type of spray often needs to be primed by squeezing with the thumb and fingers a few times until mist or mist sprays actually comes from the bottle and the nozzle. Some nose sprays still come in squeeze bottles like these, which do not usually need to be primed. To use, you'll squeeze the bottle firmly on each side. And the type of picture shown here with the saline mist. Step by step process. First, you're going to put on the gloves. Of course, this is after you wash your hands properly. Second, ask the client to blow his or her nose gently to clear the nasal passageways so they can be ready to receive the medication. Ask the client to tilt his or her head forward slightly and breathe out slowly. Insert the tip of the bottle and aim it and away, up and away from the center of the nose. Squeeze the pump on the sides of the bottle and ask the client to inhale slowly. Or they can just sniff just slightly, as if they were smelling a flower. They should not snort the medicine, or it will end up in the back of the throat where it won't be effective. Remove the tip from the nose. Have the client exhale through the mouth. The client may blot their nose with tissue, but caution them not to blow their nose for several minutes so that medicine can properly work as designed. Rinse the tip of the bottle with hot water or wipe it with an alcohol pad. Make sure it is dry with a tissue before recapping. Again, it is important to hold the nose spray with 2 fingers around the base of the tip and the thumb on the bottom of the bottle. When administering, squeeze the 2 fingers down towards the thumb. Some nasal sprays will have different ways to squeeze the bottle. For some, you may squeeze the side of the bottle. Again, you should always familiarize yourself with the type of bottle you are using and how to properly administer the medication. Check with the client later to observe the response to medicine, especially if the nose spray is a PRN. If it's a PRN, document the response on the back of the mark. Sometimes nose sprays are not utilized. Instead, nose drops are utilized. Here are your step by step. Again, put on your gloves, of course, after you have washed your hands thoroughly and properly. After putting on the gloves, you will ask the client to blow his or her nose gently. Do not touch the nostrils with a dropper or bottle tip. Have the client tilt their head back as far as possible or lie down on a flat surface like a bed and hang their head over the edge. Place the correct number of drops in each nostril. Ask the client to sit up, bend their head forward toward their knees, and move it back and forth, remaining in that position for a few minutes. Again, you will clean that dropper properly and replace the cap onto the bottle. Nose drops are less common than they used to be, so you may never ever have to utilize them. However, if you do use them, make sure you follow these steps properly, and the head position is very important. If the head is not far enough back, the drops will not run down to the back of the throat. Again, if the head is not far back enough, the drops will run down to the back of the throat. In step number 6, the client should be leaning slightly forward, chin towards the chest, gently shaking the head back and forth. Again, nose drops are not the most common currently in the medicine world, but we do find them from now and then. Transdermal medications. Here are some examples of adhesive transdermal patches. The picture on the right shows different layers. Note that the release liner is designed to deliver the medicine to the client steadily over a measured amount of time. If you cut the patch, the function of this liner will be destroyed. The adhesive for pain is replaced usually every 3 days. Adhesive for the cover, if it becomes loose, for high blood pressure is replaced weekly. Never, ever again cut the adhesive transdermal patch. All medicine could be delivered too fast, causing the over-medication, or it could be wiped away and wasted, causing the client to be under-medicated. Transdermal medications have many different forms. Almost all of them are adhesive patches. Nitrobid ointment is different, using an ointment applied to the paper applicator. Always be sure to read the package instructions thoroughly and the prescriber orders. Always wear gloves after washing your hands when applying these patches. Tape on with measured amount of ointment applied for high blood pressure, replaced twice daily or as ordered. Often ordered for a period of time, then off for a period of time. Both on and off must be documented on your MAR. Step-to-step procedures for transdermal medications include: step 1, remove the old patch and dispose of it properly. Number 2, make sure the site for the patch is clean and dry. Number 3, open the package and remove the patch. Number 4, date and initial the outside of the patch with a permanent marker. 5, remove the backing of the patch. 6, apply the patch to the skin, pressing firmly around the edges to make sure it sticks well. Number 7, if applying nitroglycerin ointment, measured onto the provided paper applicator, place the paper on the skin, ointment down. Tape the paper to the skin, mark the date and time and initials on the tape with a permanent marker. Always wear gloves while applying to patches after you wash your hands. Do not put the patch on the same place the old patch was. Do not put the patch over a bony area like the collarbone or shoulder blade. Do not put the patch over a pacemaker site. Apply in a hairless area. Avoid the areas of increased warmth, such as the back if bedbound, would promote faster absorption. Do not put on areas with redness, rash, or broken skin. Topical medications can come in many types, and these types include ointments, lotions, creams, solutions, gels, pastes, tinctures, foams, soaps, sprays, powders, and shampoos, and they are used to treat a wide variety of problems of the skin and the scalp. Topical medicines are applied to the skin, including the scalps. Helping clients to apply their own medications is a good way to promote self-care and progress towards their independence. Step-by-step instructions on how to apply topical medications. Step number 1, make sure you understand where the medication is to be applied. Number 2, wash your hands and then wear gloves. 3, make sure the site of the medication is clean and dry, unless you're using a shampoo or a special soap. Number 4, shake lotions before using. Number 5, squeeze a small amount of medication, if a cream, lotion, or ointment, onto the applicator or to your gloved finger. You can also encourage the client to apply the medication. Apply gently to the correct site. Number 6. Number 7 is warm lotions and creams in your hands before applying to a large surface area. Keep powders away from the client's nose and mouth to prevent inhalation. Number 9, do not apply topicals to the areas with redness, rash, or broken skin unless that is what it is being treated with the proper topical medication. Number 10, if a spray, hold the can about 6 inches away from the site and then spray. Number 11, lay any dressing over the site if applicable and make sure it's secure. You may only apply simple dressings to cover and protect. Always use the amount prescribed. It is easy to use too much, so be diligent in this case. Please be diligent and make sure it's the right amount. Some topicals come with a plastic measuring strips or other measuring devices to help you use and ensure you use the correct amount. Always look before measuring device in the package if the directions tell you to use one. The MAR should state specifically where on the body you're applying this medication. An order for use as directed or apply as affected area must be clarified before you can utilize this medicine with a client. Eye medications are provided as ointments or liquid drops. If the client needs both types given at the same time, give the drops first. Wait at least 5 minutes after giving the eye drops to administer in the eye ointment. You may need to clean the eye area before giving the medication if discharge or crusting is present. Use cotton balls moistened with warm water unless ordered otherwise. Using each cotton ball for only one stroke. Start the inner corner of the eye and work outward, away from the nose. If you use a washcloth instead of cotton balls, rotate the area of the washcloth with each stroke. When cleaning the eye area, be very careful not to press down on the eye. Always wipe away from the eye. Make sure you are gentle with this process. Many eye infections are highly contagious. Never touch your face or eyes during or after care for a client's eye until you have washed your hands thoroughly. And of course, goes without saying, before doing this medication type, you need to make sure your hands are clean prior to doing this, as well as washing your hands after doing this process. Step-by-step instructions for eye medications. First and foremost, wash your hands thoroughly and properly, and always wear gloves for eye medications. Number 2, have the client sit or lay down with their head tilted back. Give the client a tissue to use if needed. Step number 4, gently pull down the lower eyelid, forming a small pocket or pouch. Number 5, ask the client to look upward. Number 6, drop the medication into the center of the lower lid into the pocket that you have made. Number 7, if the ointment is being utilized, gently apply the prescribed length of ointment along the inner edge of the eyelid in the pocket, moving it from the inner to the outer eye. Number 8, do not touch the eye with the dropper or the tube, and do not drop the medicine directly on the eye. If you miss the eye, repeat the procedures. And finally, dispose of the gloves immediately and wash your hands thoroughly after completing your eye procedure with your client. Step-to-step procedures on ear medications. Step number 1, warm the bottle to room temperature by holding the bottle in your hands. Number 2, position the client with the affected ear up. They can lie down or sit with their head tilted to the side. 3, wash your hands and then wear gloves. Number 4, pull the ear up and back and drop the prescribed number of drops into the ear. Let them fall on the side of the ear canal and not directly in the eardrum. Do not touch the ear with the dropper or the tip of the bottle. Release the ear and ask the client to stay in position for 5 minutes. Number 7, if prescribed, repeat for the other ear. You may enter cotton ball in the outer part of the ear if it has been ordered to do so by a medical professional. There are 3 types of rectal medications you may need to assist with. The first type is a suppository, solid but readily meltable cone or cylinder of usually medicated material for insertion into the rectum. Enema, infusion of liquid into the rectum by the way of the anus. Rectal gel, pre-filled unit dose of medicine provided in a syringe into the rectum into an emergency to stop seizures. Step-by-step instructions for suppositories. Have all supplies ready. Wash your hands and wear gloves. 2, place a pad under the client. 3, position the client on their left side with their right knee raised towards their chest, if possible. Number 4, lying on the left side helps the medication to move easily into the rectum and relaxes the anal sphincter muscle. Always provide privacy when using this type of medicine route. An explanation of what you're doing. Explain each step as you do it. For example, you're going to feel me touch you now. This might be a little cold. You may feel some pressure. These are important things while you provide this medicine. Number 5, remove the suppository from the package and lubricate the point end with the water-soluble lubricant such as KY jelly. Do not use petroleum jelly. Number 6, part the buttocks. Ask the client to relax and concentrate on breathing. Number 7, gently insert the suppository to the anal canal until at least the first joint of your finger is past the sphincter. Try to place it along the side of the rectum. Do not attempt to push it through. Number 8, hold the buttocks together for a few minutes until the urge to push suppository out has passed. Ask the client to remain on their side for at least 5 minutes and to retain the suppository for about 30 to 45 minutes if possible.
Step-by-step enemas. Number 1, position as for suppositories on the left side with the pad under the client. After washing your hands, wear your gloves. 2, insert the lubricant enema tip slowly into the rectum. Squeeze the bottle slowly until the contents have been fully emptied. 4, while squeezing the bottle, withdraw the enema tip carefully. This prevents the sucking enema contents back into the bottle. Encourage the client to hold the enema in for as long as possible before using the bathroom. 6, make sure someone is available to assist the client to the bathroom if necessary. Remember to check the results the client had from the enema. Did they have the bowel movement or just expel the enema? You need to chart this and document this on the MAR. Rectal gel step by step. Put the client on the left side, making sure they can't fall. Push up with your thumb and then pull to remove the cap from the syringe. Be sure the seal pin is removed with the cap. Lubricate the tip of the syringe with water-soluble jelly. Some is included in the kit. Separate the buttocks and gently insert the syringe tip into the rectum. The rim should be snug against the rectal opening. Slowly count to 3. 1, 2, 3, while gently pushing the plunger until it stops. Slowly count to 3 before removing the syringe. 1, 2, 3. Again, count to 3 while holding the buttons together to prevent any leakage. 1, 2, 3. Make sure to note what time the medicine was given. Follow the prescriber's orders for what to do if the seizures persist after a defined amount of time has passed. Keep the client on the side as you observe them. Very important, rectal gel for seizures is considered to be an emergency medicine. Because of this, a MAP may give this medication if they have not yet received validation of the rectal route. See 65G-7.005 of the code. This medication is used for active seizures. Primary consideration is keeping the client safe, unable to fall or hurt themselves. A plan will be done of what will be done and how it is important to have ahead of time. Know that this medication, it should be double locked somewhere. Know who has the keys at all times. Know what doctor's orders are before using it. Also, observation afterward. Know when to call 911 and review this information often when you review the rectal gel procedures policy. This next section is about giving internal medicine, not about prescribed internal formula administration. To give prescribed internal formulas, you must take the course called Prescribed Internal Formula Administration that's taught by an APD approved trainer. If your client receives prescribed internal formula, a MAP who has taken the required course and who administers the prescribed formula must administer these type of medications. If you have taken the required prescribed internal formula administration course, you must follow the procedures and techniques for flushes and residential checks when giving medications that are taught in that course. It is extremely important that you understand how to use the type of tube each client has. If you are asked to give medicine through a tube or a device you do not know how to use, you must definitely ask for help. Never give medicine through a nasogastric tube, feeding tube in the nose. You may need to be validated on the tube by an LPN, RN, or MD. Always check with the supervisor if you are unfamiliar with a tube or device. The supplies for internal medication include a 60 ml catheter, tip syringe, extension tubing, gloves, a pill crusher of some sort, warm water, and cups to mix and dissolve the medications in. Medications of internal medication administration must be prepared so that they will flow easily through the gastric tube. You must have an order to crush, dissolve, or dilute the medicines. Crush any solid medications into a pill crusher. Mix each medication separately in a 10 to 15 milliliter of warm water or an amount ordered as by the prescriber. Use warm water. Cold may cause abdominal cramping. Some liquid medications need to be diluted. Check your order. Each medication will be given separately from the others, followed by a flush of 5 to 10 millimeters. Check your orders again. The prescriber should have given a specific orders for the flushes between each medication. Liquid medication should be given first, followed by the meds that are dissolved in water, with thick medications last. As this picture shows, you should not lay your client flat. Anything less than 30 degrees will cause reflux and aspiration. Sitting straight up may not be a comfortable position for internal medicine administration for some people, but it works well for others. You must know your clients. Again, you cannot lay them less than 30 degrees. They must be 30 degrees up to 90 degrees. If the head of the bed must be elevated at least 30 to 45 degrees. If sitting in a recliner, 30 to 45 degrees. Some clients prefer to sit straight up, others don't. Again, know your client. Internal medicine's step-by-step procedures. Please wash your hands thoroughly and wear gloves. Step number 2, connect extension tubing. If necessary, make sure to prime it with water first to remove any possible air. 3, if you have more than one port on the tube, make sure you're using the correct one. Flush the tube using the 60 ml catheter tip syringe. Remove the plunger from the syringe and connect the syringe to the tube. Pour 60 to 30 milliliters of warm water, or the amount ordered by the healthcare practitioner, into the syringe. Step 5, if using a G-tube, also called a PEG, allow the tube to drain by gravity to flush. If using a J-tube, you may need to insert the plunger and push gently to flush. Very important, do not force a flush. If the tube is not flowing easily, contact your supervisor immediately. It is very important that you use the correct port if there's more than one. Step number 8, pour the first medicine into the syringe and allow the flow to slowly by gravity for the G-tubes. If using a J-tube, you may need to insert the plunger and push very gently. Do not force. Step 9, flush with 5 to 10 milliliters of water by gravity after each medicine. Number 10, repeat each medicine until all medicines are given. Step 11, give the liquid medicines first, medicines that need to be dissolved second, and the thick medications last. 12, when all medicines have been given, flush the tube with 30 to 60 cc of warm water, or the amount ordered by the healthcare practitioner. With the syringe still in the tube, clamp the tube as the last of the liquid flows in. Remove the syringe and cap the tube if necessary. Disconnect the extension set and reinsert the stopper or plug. Rinse equipment with warm water and let dry. Replace the equipment every 24 hours. Encourage the client to remain upright for at least 45 minutes to prevent any reflux or aspiration and to promote digestion. It is really important that the client stays upright at least 30 degrees minimum for 45 minutes, especially if higher flush volumes were used for many medications. After medication administration, if you're giving your client all their medications, what do you do now? Before you give medications to another client, you must remove gloves, dispose of it properly, wash your hands thoroughly, put away all medication supplies, lock the medication storage area, and secure the key. Document administration on the MAR. It is important to document immediately so that you can ensure that the proper documentation is made. You need to monitor the client for at least 20 minutes following the first 3 doses of a new medication. Remember, if you give a PRN medication, you must record why the client needed it on the back of the MAR, and you must record response to the medicine later in the same place using the same line. Again, I just need to ensure that you document also after the first 3 doses that you monitored, and if there's no side effects, you need to clearly indicate no side effects. If there are side effects, you need to document as well. Always finish the medication process for one client at a time, including the documentation, before you start the process with another client. We spent a lot of time on what to do with the client. let's talk about what not to do. Make sure you understand this because it's important to understand what you are not supposed to do. Number one, never assume anything. Always ask the designated person at your facility, a nurse, if possible, if you have any doubts or questions about medication orders. Number two, do not prepare syringes for injection. Number three, do not give vaginal medications. Topical medications may be applied to the skin outside the vagina, but no medication may be inserted into the vagina. Do not give any medication into a tracheostomy. Number five, do not irrigate or remove dead skin wounds from the wounds. If a client can self-administer insulin without supervision, you may bring their pre-measured syringe at the correct time. You may apply a track mask for oxygen if you have been trained to do so, but you may not put medication into the stoma. It's time to practice, practice, practice. This is your class activity 3. So you will stop the video and actually conduct the practice with your instructor. At this time, after you finish the practice, you will resume the video and continue the rest of the class. Good luck. Documentation on the MAR. Monitors and others will regularly look at the MARs. Incomplete MARs or MARs that have errors may result in notices of noncompliance. At Evans Group Home, this is a requirement. Documentation must be complete and must be completed correctly. Remember, if it is not documented, it did not happen. When a MAP gives a medication or supervises a client giving themselves a medication, it must be written down. Where you write it down, it's the MAR, the Medication Administration Record, as we commonly call MAR. This is where the documentation occurs. We have looked at these briefly in this section. We will go further in detail. Using the MAR correctly is a critical skill with no room for error. APD requires 100% accuracy on the MAR exercise part of the exam, as 100% accuracy is required for all documentation on the MAR. This means you cannot make any errors when filling out the MAR you will be given. Please make sure that you understand how to document on the MAR as we go through this part of the class. There will be an exam that you will have to complete, and again, 100% for the MAR exercise part of the exam is a requirement. When should you document on the MAR? After the client has actually swallowed medication or after it has been applied, inhaled, inserted, or by whatever route the medicine has been given or supervised. If a medication is not given, should you document it on the MAR? That is, yes, you should. You still have to document even if the medicine is missed. This is where you explain why the client did not get the medication, and to show that you are aware that it was missed. The pharmacy that provides your client's medication also gives you a MAR. Do you have to use the APD MAR? No, it's not an APD requirement. If the pharmacy or facility MAR contains the required information that's required by APD, you may use it. This includes electronic MARs provided by some pharmacies or other companies. Note, many pharmacy MARs will use a coding system for reasons a medication is missed. APD used this requirement, but is no longer required. If these are still on the pharmacy MARs, you can ignore them or just write the reasons the medications was missed on the back of the MAR. Before we talk about this slide, there's something very important to understand. Research has been done, and research has shown many times that medical abbreviations are difficult to read and often misinterpreted. Many doctors still use them, but pharmaceuticals translate them into the medicine labels. Because MAPs must compare the prescription to the MAR and to the pharmacy label, they must understand what the common abbreviations mean. Important notes about the MAR documentation. The order written on the MAR must match the pharmacy label exactly. If the medicine label reads Depakite ER 500 mg twice daily by mouth, that is what should be written exactly on the MAR. The prescription might read Depakite ER 500 BID PO, but the pharmacy labels to spell out all abbreviations. You must compare all three and make sure that they all match. Do not use abbreviations on the MAR. You must know what they mean because you will see them, but do not use them. They are confusing and can cause medication errors in the future. If you complete the medication administration for one client, including documentation on the MAR, before you start another client medication pass. The MAR for each client must have the written name and signature, plus the initials of each MAP or nurse who administers the medication to or supervises self-medication of the medications for that client. Abbreviations were used more often when prescribers had to handwrite all prescriptions. They are easily confused when handwritten, and this has led to many medication errors in the past. Electronic ordering prescribers has decreased the use of abbreviations, but you will still see them. Abbreviation AC, before meals. BID, twice a day. CAP, capsule. GTT, drop. HS, either lowercase or higher or uppercase. Hours of sleep. mg, milligram. ml, milliliter. OD, right eye. OS, left eye. OU, both eyes. PO, by mouth. PC, after meals. PRN, as needed. QD, every day. QOD, every other day. TAB, tablet. Q3H, every 3 hours. QID, either uppercase or lowercase, 4 times a day. TID, or uppercase or lowercase, 3 times per day. DC, with a D/C, either capital or lowercase. Discontinue. You may see these on orders or prescriptions. The pharmacy will spell them out on the medication label. They will not use abbreviation. You should not use these when writing the order on the MAR. When you compare the label to the prescription, you must be sure they mean the same thing. Call the pharmacist immediately if you do not understand or are not sure how to clarify the order. Let's talk about the required information on for the documentation on the MAR. Number 1, client's name on both sides. 2, allergies to food or medication. 3, name of each medication prescribed for the client. 4, prescribed dose of each medication. 5, strength of the medication. 6, the name of the health practitioner who prescribed the medication. 7, the date of the medication was ordered, changed, or discontinued. 8, scheduled time of the administration for each medicine. 9, route by which the medication is to be given. 10, prescribed instructions for crushing, mixing, or diluting the medication if needed. 11, date of the medication was given. 12, initials and signature of each MAP or licensed healthcare professional that gave or supervised the client's self-medication in the square for which the date and time of the medicine was given. This is a lot of information, but it is important information. Licensed healthcare professionals are required to document any medication they give or miss as well. And there's more. This is the back of the APD MAR. Be sure to write the name of the client on top. On this side of the MAR, you will document scheduled medications that are not given and information about the PRN as needed medications when they were given. What was the response? It is acceptable to attach more than one back of the MAR to the front. This could be the case if there's a lot of documentation that's needed. A record of any missed medication is also required. The MAP must initial and circle the square on the MAR for each medication. Write the reason of the medication was not taken on the back of the MAR. These could and might include refused, when the client refuses to take the medication. At work or ADT, the client is at a regularly daytime activity. Home with family. ER, hospital. Client is in a medical facility at the time. Not given requires an explanation. Why? Held by MD. Explain it. Problem with pharmacy. What was the problem? Refill not ordered timely. Explain why. There are many other reasons a medication might not be given. You must write what it is in the space provided. The information will be used when filling out the medication error report. You must fill out the back of the MAR completely with the date and times, name of medications missed, the reason why the medication was missed, and your initials. One major reason medications are missed is because of distractions and the MAP forgets. It is okay to put on the MAR and the med report. It is good information to have to prevent future errors. Medications that are missed at several times in a row can be documented on the same line. For example, the client is in hospital or vacation with the family. And finally, also on the back of the MAR, the MAP must indicate why PRN as needed medications were given and if they helped. What symptoms did the client have? Fever, cough, anxiety. Remember that you may only give PRNs for the reason that they are prescribed. Come back later, 30 minutes to an hour, and document the client's response to the medication. Was the fever reduced? Was the temperature right now? Is still coughing or not? Anxiety, was it relieved? Also, document the client's response to any new medication, including PRN medications. For the first 3 doses of any new medication, observe the client after giving it for at least 20 minutes to detect potential side effects. The documentation must include any adverse reactions, but also must include the lack of adverse reactions. Document anything else concerning the client and their medication administration that is out of the ordinary. When documenting client's response to new medication, the map should write down if there was any adverse reactions, but they must also write down if there's been no adverse reaction that was observed. Changing an order on the MAR. When a client's medication order is changed or discontinued, you do not change the original entry on the MAR. The original entry must be marked changed, discontinued, with the date and time, initialed, and highlighted in yellow over the entire row. The new order is written in a new line. You will see how it looks on the next slide. In the example shown on the next slide, the new medication order takes a medication that was originally ordered at 2.5 megs by mouth daily and changes the order to the same medication at 2.5 megs by mouth each morning on Monday, Wednesday, Friday, and Sunday, and 5 mgs by mouth on each morning Tuesday, Thursday, and Saturday. Another order discontinues the client's medicine completely. Notice how the parts on the grid will not be used that will not be used are dealt with. You do not want to obscure the grid, but you must make it clear on which days doses are given. This particular medication is often ordered this way, but there are others that are given every other day or once a week that you must be treated similarly. It is important to change or discontinue medications correctly, and they are very visible on the MAR. This prevents medication error, giving the old and new medications at the same time. As you can see, based on the previous slide, the medication on 7/15/19, the after AM dose was given. The rows highlighted in yellow. Changed date initials written across those days, the medication won't be given. Medication discontinued on 7/24 after AM dose was given. Row highlighted in yellow, discontinued, date, and initials were written across the days medication won't be given. New order with different doses are on different days of the week entered beginning on the 16th. As you can see with this one arrow pointing to across the cells indicated not started, horizontal line drawn across each day, the medicine is not to be given. Time-limited orders on the MAR. Time-limited orders on the MAR. Many medications are given for a short time. The most common of these is antibiotics, but there are others as well. A time-limited order does not need another order to discontinue the medicine. The order to discontinue is contained with the original order. You might see orders like these demonstrated on the next slide. Amoxicillin 250 mg by mouth 3 times daily for 7 days for bronchitis. Vitamin D 50,000 units by mouth once weekly for 4 weeks. And so on. Of course, it would be unlikely for any one client to receive all of these type of medications at the same time, but these are the fairly common orders that you may see. These are examples of medication ordered for only a limited time. Note that none of the spaces on the MAR are blocked out, so they cannot be seen. You should use black ink. Black ink is required on the MAR. The arrows were drawn in blue for emphasis on the slide. If an error is made, line through, write error and initial. Never use whiteout or completely blacken any part of the MAR. In this case, the error was stating the medicine on the wrong MAR, indicating the first dose. No documentation is needed on the back of the MAR. Whiteout should never be used. Again, never be used. And you should never completely blacken any square. This is what the back of the previous MAR should look like. Only the first two medications are shown, but similar documentation would be done for the other two. You can see that the entire back of the MAR might be quickly get filled, especially if there were also some PRN medications. This is when you would staple another back to the MAR, stapling it only to one end so that you can flip the sheets back and forth. PRNs medications may not be used for any condition they were not ordered for. If Benadryl was ordered for itching, it may not be used to help the client sleep, even though that is a common use for Benadryl. If Benadryl is ordered for sleep, it may not be used for itching. When administering PRN medications, the client must be observed for at least 20 minutes to see if the client complaint has been resolved. 20 minutes is the minimum amount to observe. Some medications take longer to work. This is the back of the MAR we just looked at. Note how the PRN medication comments say why the medication was given and tell us what the result of the taking the medication was. These comments are required. If the medicine did not make the symptoms better, it must also be written down as such. Medications that are not given must be also have a comment that explains why the client did not take the medication. These comments explain what is being done about the reason the medicine was not taken. This is the ideal. Often we get students who are new to this medication process ask, what do I do with all these forms that we complete? Medication forms are kept in the client's record where the client lives. Completed MARS, completed controlled medication count forms, current authorization for medication administration, original informed consent form, off-site custody of medication form for each absence, copies of the medication error forms concerning the client. Keep the MAR currently in use, the MAR for the current month, off-site custody of medications awaiting return of client, information about side effects, adverse reactions, and drug interactions for each medication may be the drug monograph supplied by the pharmacy with the medicines, copies of the prescriptions or orders for current medications, copies of the lab reports or consultations related to the medicines. If a computerized MAR system is utilized, MAPs may need to be able to demonstrate that they can find the information and about the medications quickly. They need to be able to show clients MARs to monitors and others authorized to see it when it's requested. Copies of the prescriptions or orders, off-site custody forms should be readily available for reference. Time for class activity 4, practicing the MAR documentation. Please stop the video and then return to replay for the video when the activity is done. Time for a break. Give your brain a short little break. We're going to take this break and then we're going to resume the video. Again, stop the video and then return to the video once the break is completed.